Alright guys, so we're talking about the pancreolauryl test. Pancreolauryl test. Alright, pancreolauryl test. Alright, so look at the procedures, what is used in this test, and why it is done. Right, so this is like the basis of the test, right? So that the pancreolauryl test is a non-invasive diagnosis test. So it's used to access what? Pancreatic exocrine function. So you are doing it because you want to examine how the pancreatic enzymes are functioning. You understand? You are doing it to see how these enzymes are functioning. You get? So those are all those lipase, all those enzymes for digestion of carbohydrates, proteins, and the rest. Right? So for the procedure, so that the test involves taking a tablet containing what? Fluorescein dilaurate orally. You see this one? The fluorescein dilaurate orally. Okay, so normally the pancreatic x-rays should break it down. Do you understand? All right, so let's move. We say that this compound is hydrolyzed by what? Pancreatic enzymes into fluorescein, which is then absorbed by the intestines and excreted in urine. You get? So for interpretation, urine is collected for about 10 hours. After 10 hours, and the amount of fluorescein excreted is measured. So this will now test that, okay, were the enzymes really functional to break down the fluorescein dilaurate? You get? So the results are compared to a controlled test using free fluorescein. So like free, they can also give you free fluorescein where there's no need to break it down. So they now compare the one that was needed to be broken down with the free one, the amount in your urine. You get? So the results are compared to a control test using free fluorescein to account for what? Individual variations in your intestinal, hepatic, and renal function. So minus the pancreatic enzyme, they can also use it to what? Evaluate your hepatic function, your renal function, and all of that. So interpretation is a ratio of less than 20% of fluorescein excreted after fluorescein dilaurate compared to free fluorescein is considered abnormal. So it should not be less than 20% of what? The fluorescein dilaurate that you give. If you give 100 milligrams, at least 30, 40, 50 milligrams should be found in urine. You understand the basis of this test, right? So this will actually indicate that if it is less than 20, indicate that the enzymes are insufficient. So it indicates that what? Pancreatic there's what? Pancreatic exocrine insufficiency. Alright. So it's an indirect test for measuring what? Pancreatic function by giving oral fluorescein dilaurate, which is measured in a timed urine. So fluorescein is released and absorbed. So the amount excreted in the timed urine sample is measured. So this one is just like a summary of what? The pancreolauryl test. Alright. So I hope this was beautiful. Okay. So that's it for the basis of this test.